If you've ever wondered why your husband's needs changed after 50, you're not alone. Studies show nearly half of married men in their 60s experience shifts in sexual behavior caused by hormone decline, and most wives never get told the medical reason behind it. Today, let's look at what's really happening inside his body and his mind. I'm Dr. Eliza Hart, a board-certified women's health specialist focusing on hormonal changes and intimacy after midlife. Over the years, I've seen countless women feeling confused or distant from their partners, not realizing that biology, not betrayal, is often what's changing the relationship. In this video, I'll explain the medical and psychological roots behind these changes, how declining testosterone, dopamine, and emotional stress reshape a man's behavior after 50. More importantly, I'll show you how understanding these shifts can protect your emotional well-being and rebuild healthy connection at any age. Because when you understand the science, you no longer fear the change, you can respond with confidence. If you've noticed these shifts in your own marriage or relationship, share your thoughts in the comments. Type 1 if you've seen it happen, or 0 if not yet. Your experiences help me shape future videos so we can talk honestly about what women over 50 really face. Now let's start with the first question. Every woman deserves a clear answer to why do older men develop these unusual desires in the first place. 1. The biological roots of desire after 50. When we talk about intimacy and aging, most people think of emotional distance or changing preferences. But the truth begins much deeper at the hormonal level. As men reach their 50s, their bodies start to undergo a gradual yet profound internal shift. According to Harvard Health data, testosterone levels in men decline by about 1% every year after the age of 40, and by 60, that loss can reach 20 to 30%. This single hormone plays an enormous role, not only in sexual function, but also in energy, motivation, confidence, and emotional stability. When it drops, the entire biochemical landscape of the male brain changes in ways that few couples ever discuss. Testosterone interacts directly with neurotransmitters like dopamine and serotonin, the very chemicals responsible for pleasure motivation and emotional connection. As these systems weaken, the brain begins to seek stimulation elsewhere, not necessarily through infidelity or extreme behavior, but through novelty. It's a biological attempt to reawaken the reward pathways that once lit up effortlessly in youth. Many men describe this as a sudden craving for excitement, a need to feel alive again. From a medical standpoint, it's not about moral weakness or midlife crisis. It's a neurological adaptation to a changing internal environment. What complicates this further is that hormonal decline rarely happens in isolation. Sleep quality deteriorates, metabolic rate slows, and stress hormones like cortisol rise. These factors together can lower self-esteem, reduce endurance, and amplify irritability. For many men, this creates a subtle but painful erosion of identity, a feeling that they are losing control over their bodies, and by extension, their masculinity. In clinical practice, I often see this manifest as restlessness, risk-taking, or sudden changes in behavior that leave their partners confused. Understanding this biological root is not about excusing harmful actions. It's about recognizing the silent physiological changes that influence behavior. When you realize that these shifts are driven by chemistry, not coldness, you start to view your partner with clearer eyes, less fear, more awareness. Because every change in desire, every fluctuation in behavior is first written in the body long before it becomes visible in the bedroom or the heart. Comorbidities matter too. Hypertension, diabetes, sleep apnea, and certain medications, including SSRIs or beta blockers, can blunt libido and arousal. Screening and management of these factors often restore stability long before relationship patterns need to be questioned. 2. The psychological layer of aging and male emotional shifts. While hormones lay the foundation, The psychological impact of aging often determines how those biological shifts are expressed. In clinical practice, I've seen that when testosterone drops, it's not just the body that changes, it's the man's entire sense of self. A decline in strength, energy, and sexual confidence often triggers something psychologists call identity destabilization. Men begin to question their worth, their relevance, and their ability to be desired. For many, this is the first time in life they've had to confront their own physical limits, and that realization can feel profoundly unsettling. A 2019 study from the American Psychological Association found that nearly 50% of men between 55 and 70 report feelings of invisible aging, the sense that society no longer sees them as powerful or attractive. This perception can quietly erode emotional stability. It explains why some men start chasing validation through novelty, risk-taking, or even uncharacteristic behavior. These aren't random acts. They're subconscious attempts to reclaim the admiration they fear they've lost. From a psychological standpoint, this is less about desire and more about reassurance, the reassurance that they still matter. Men also experience what we call emotional narrowing. Years of social conditioning have taught them to suppress vulnerability. As they age and hormone levels fluctuate, emotions they once kept buried, fear, anxiety, loneliness begin to surface, but without the tools to process them. Instead of articulating these feelings, they may express them through sudden irritability or unfamiliar fantasies. It's a distorted language of emotional need that women often misinterpret as selfishness or detachment. Another under-recognized factor is performance anxiety. As physical endurance and response time change with age, many men start associating intimacy with the fear of failure rather than connection. This anxiety can paradoxically lead to avoidance, or in some cases, overcompensation through exaggerated gestures of dominance or experimentation. Both stem from the same place, an unconscious effort to protect a fragile sense of worth. Understanding this psychological layer allows us to respond with insight rather than instinct. It reminds us that what appears as strange behavior is often an outward reflection of inner loss, a loss of identity, validation, and control. For women, this knowledge becomes power. The ability to recognize pain where confusion once lived, to see insecurity where frustration used to dominate. And with that awareness comes the foundation for healthier communication, which we'll explore next when we look at how these emotional shifts translate into daily interactions and relationship dynamics. 3. The behavioral expressions, when biology and emotion begin to show. Once hormones and emotions start to shift, those changes inevitably begin to surface in daily behavior. What begins as an internal imbalance soon becomes visible in how a man relates, reacts, and seeks connection. This is often the stage where many women start to notice that something feels off, even before they can name what it is. Small habits, subtle tone shifts, or new requests appear, and they often carry meanings that go far deeper than they seem. From a clinical perspective, these behaviors are the external translation of internal chemical and emotional fluctuations. When dopamine levels drop, the brain's reward system becomes less sensitive, leading some men to seek stimulation through novelty. That might mean taking sudden interest in unfamiliar activities, experimenting within intimacy, or craving attention in ways that never existed before. It is not necessarily rebellion or infidelity. More often, it's the body's way of asking for the neurochemical excitement it once produced effortlessly. At the same time, cortisol, the stress hormone, often rises with age, amplifying irritability and impulsivity. Combined with low testosterone, this creates what researchers call a frustration loop, a cycle where dissatisfaction fuels tension and tension fuels even greater restlessness. In my consultations, many women describe this as walking on eggshells, unsure whether to comfort, confront, or withdraw. The reality is, these shifts are neither purely psychological nor moral. They are physiological responses looking for emotional resolution. Another pattern that frequently emerges is reassurance-seeking behavior. Some men become unusually expressive or attention-hungry, while others retreat into silence or work obsession. Both extremes reflect the same underlying struggle, the fear of being invisible. Recognizing this doesn't mean tolerating behavior that crosses boundaries, but it does allow you to interpret what's really being communicated, often the need to feel significant again. For some couples, these moments mark a turning point. When addressed early and compassionately, they can become opportunities to rebuild connection and rediscover shared meaning. But if ignored, they may grow into emotional distance that feels irreversible. Awareness, then, is not only preventive medicine, it's the first act of healing. If you're comfortable, add a comment describing one change you've noticed after 50 and one way it affected your connection. The more specific, the more helpful. Your lived experience gives other women language and relief, and it helps me prioritize the next topics we cover. You can also share a question you want a doctor to answer next. 4. The fine line between harmless and harmful desires. Every behavioral shift doesn't necessarily indicate danger, but not everyone is safe either. The most challenging part for many women is learning to distinguish between what is simply new and what is truly concerning. Clinically, we categorize these changes into two broad patterns: adaptive exploration and boundary violation. Adaptive exploration describes behaviors born out of curiosity or an effort to reignite connection, for example, small adjustments in routine or communication that bring novelty and closeness. Boundary violations, however, are those that create fear, pain, or emotional pressure, and they must never be normalized in the name of intimacy. A 2021 review in the Journal of Sexual Medicine found that roughly 1 in 5 couples over 60 report mismatched expectations regarding experimentation. Most of those disagreements resolve when both partners communicate openly and establish consent and comfort as non-negotiable principles. Problems begin when one partner uses age insecurity or male biology as justification for ignoring boundaries. No hormonal fluctuation ever removes the ethical and emotional responsibility to ensure mutual safety. From a biological standpoint, testosterone decline can lower impulse control, and cortisol elevation can intensify frustration, but these are explanations, not excuses. The goal for both partners is to restore balance, not to rationalize behavior that causes harm. In my practice, I often advise women to use 3 questions as a simple framework. Do I feel safe? Do I feel respected? Do I feel heard? If the answer to any is no, that is not intimacy. That is distress masquerading as desire. Healthy curiosity, when expressed with respect and empathy, can revitalize a relationship. But when novelty becomes a demand or a test of loyalty, it signals emotional dysregulation that may need professional guidance. Protecting your boundaries doesn't mean rejecting your partner. It means protecting the trust that sustains both of you. It's also worth noting that some men who cross these emotional or physical boundaries do so not out of malice, but from untreated psychological or hormonal distress. Anxiety, depression, or undiagnosed low testosterone can distort perception and judgment. Medical evaluation in these cases is not about blame, but about intervention. Rebalancing hormones, improving sleep, or addressing mental health often restores empathy and impulse control faster than arguments ever could. Knowledge and early detection therefore remain the strongest forms of prevention. 5. Communication and boundaries. How women can respond with clarity and strength. After identifying what drives these changes, the next step is learning how to respond calmly, confidently, and without losing your emotional center. Communication after midlife intimacy shifts requires both precision and compassion. The mistake many couples make is assuming that silence will preserve peace. In truth, silence does the opposite. It deepens misunderstanding and allows fear to grow. When something your partner says or does feels unfamiliar, addressing it early and directly is not confrontation, it's prevention. In medical consultations, I often guide women to use what we call reflective communication, stating what you heard, describing how it made you feel, and setting the expectation clearly. For example, I understand you're exploring new needs, but I need to feel emotionally safe when we talk about them. This approach validates his expression while affirming your comfort as equally essential. According to the Gottman Institute, couples who use this kind of dialogue reduce defensive reactions by nearly 40%. It's not about controlling each other's behavior, it's about creating a shared emotional map that both can navigate safely. Boundaries in this context are not walls, they're agreements. They define what safety looks like for both people. A healthy boundary is flexible enough to allow growth, yet firm enough to protect dignity. When a man feels acknowledged and a woman feels secure, the relationship rebalances itself naturally. Hormones may fluctuate, but trust acts as the stabilizer. If you sense that repeated discussions are leading nowhere involving a healthcare provider or therapist familiar with hormonal and relational dynamics can bridge the gap that ordinary conversation cannot. Still, the way you communicate matters as much as what you say. Tone pacing and timing all influence how the message lands. Avoid starting a conversation during heightened emotion or fatigue. Instead, choose moments of calm and curiosity. Research from Frontiers in Psychology in 2021 found that couples who regulate their physiological arousal before difficult discussions maintain empathy and problem-solving capacity longer. In practice, this means pausing to breathe, making eye contact, and grounding your message in genuine care rather than accusation. Effective communication is not a single event. It's an ongoing process of calibration. As both partners evolve, so must the language that holds them together. Every discussion about intimacy or boundaries should end with clarity, not confusion, a sense that both voices were heard and valued. When approached this way, communication itself becomes a form of emotional maintenance, preserving the connection even when biology and aging test its resilience. 6. The psychological roots, understanding the hidden triggers behind unusual desires. When we look beyond hormones and behavior, a deeper layer emerges, one that belongs to the realm of psychology. Every unusual desire expressed in later life, no matter how confusing it seems, carries a story behind it. These impulses are rarely random. They are shaped by decades of personal history, emotional memory, and unhealed experiences that resurface as men confront aging. In Jungian psychology, this stage is often described as the emergence of the shadow self, the part of the psyche that contains the feelings, fears, and instincts we suppress to fit social expectations. When the structure of daily life changes after midlife retirement, illness, physical decline, that shadow seeks expression, often through unexpected forms of desire. From a neuroscientific standpoint, this makes sense. The brain regions involved in memory and emotion, particularly the amygdala and prefrontal cortex, interact differently as dopamine sensitivity decreases with age. The result is a greater pull toward emotionally charged or taboo experiences which the brain perceives as a way to restore vitality. What looks like a sudden change in appetite or curiosity may in fact be the nervous system's way of compensating for emotional numbness or self-doubt. In therapy, I've often seen men whose new desires were less about pleasure and more about power, the need to feel competent, visible, and capable again. When these feelings go unrecognized, they can evolve into fantasies or behaviors that bewilder their partners. Yet once the emotional origin is acknowledged, perhaps grief, shame, or fear of irrelevance, the behavior often loses its intensity. Awareness transforms compulsion into comprehension. Women too benefit from recognizing this process. It's not your responsibility to fix his unmet needs, but understanding the mechanism can spare you from unnecessary guilt or anger. You can approach these revelations with calm curiosity, instead of alarm. Asking what might this mean for how he feels about himself reframes the situation from personal rejection to shared understanding. That shift alone can restore empathy and lower conflict. True intimacy after 50 depends on this dual awareness, knowing the biological triggers, while also acknowledging the emotional roots that biology alone can't explain. When partners learn to view each other through both lenses, science and psychology, the strange begins to make sense, and what once felt threatening becomes a path to deeper connection. Understanding the science behind men's changing desires is only valuable if it helps you create real improvement in daily life. The first practical step is to view these changes not as rejection or instability, but as signals. When a man behaves differently, more distant, more restless, or more demanding, remind yourself that biology and psychology are both in motion. Instead of reacting with fear or judgment, pause and observe. This moment of pause interrupts the emotional spiral that turns misunderstanding into resentment. Next, bring balance back to the body. Encourage habits that naturally support hormonal stability. For both of you, 7 hours of quality sleep, moderate physical activity, and a diet rich in zinc, magnesium, omega-3 fats, and lean protein. These aren't superficial suggestions. Numerous clinical studies show they improve testosterone regulation and dopamine response, both of which directly influence mood and intimacy. Limiting alcohol and caffeine while maintaining hydration and consistent meal times also stabilizes cortisol, the stress hormone that undermines connection. On the emotional level, reintroduce non-sexual affection. Gentle touch, eye contact, shared laughter, or even cooking together rebuilds oxytocin, the bonding hormone that counterbalances anxiety and insecurity. Many couples over 50 forget that physical closeness doesn't always have to lead somewhere. Sometimes it's simply about reassurance. When affection is given without expectation, it restores safety and trust faster than any conversation. Finally, approach communication as a continuous practice, not a reaction. Schedule open discussions once or twice a month, keeping them short and honest. Focus on understanding, not verdicts. If frustration repeats, consider professional guidance early. Counseling or medical evaluation can uncover hormonal or psychological triggers that are impossible to fix through willpower alone. Remember, intimacy in later life is not about perfection. It's about adaptation, awareness, and the courage to keep learning each other. When we bring everything together, one truth becomes clear: men's unusual desires in later life are not random or immoral. They are physiological, psychological, and deeply human. Testosterone, declined dopamine imbalance, emotional loss, and identity fear all converge to reshape how a man experiences intimacy. For women, understanding these processes transforms confusion into clarity. You no longer have to interpret every behavioral change as rejection or betrayal. Instead, you can see it as part of the body's aging rhythm and the mind's adaptation to it. The most powerful thing you can do is stay informed. Knowledge is protection. Learn about the effects of hormone decline, the emotional responses that accompany it, and the ways both partners can adjust lifestyle and mindset to protect their relationship. When you treat intimacy as an evolving partnership rather than a fixed expectation, you give both yourself and your partner the chance to rediscover connection in a mature, grounded way. Remember that safety, respect, and curiosity are not luxuries. They are the foundations of love that last beyond physical youth. If you're facing these changes now, take a gentle approach. Communicate clearly, care for your own health, and invite your partner to walk beside you through this season of life, not against you. With empathy and informed guidance, love after 50 can be calmer, deeper, and far more authentic than anything that came before it. Thank you for watching and for being part of this space where women can learn, heal, and speak openly about subjects often left unspoken. If today's discussion helped you see things differently, please subscribe, share your thoughts below, and let me know what topics you'd like me to explore next. I'm Dr. Eliza Hart, and I'll see you in the next conversation on women's health hormones and the power of understanding.